Hi, I'm Dr. Deendayal from Mamta Fertility Hospital, Hyderabad, and we have completed 23 advanced laparoscopic gynec surgeries in the last 36 hours with Dr. Jay.
They say abdomen is a Pandora's box, but I think Dr. J. Mehta has cracked the puzzle and brought the genie out of the abdomen.
Now let's go a little back in time to where it all started. On 28th February, Dr. J. Mehta had a flight to catch for Hyderabad at 2:30.
हाय गाइस, तो आज हम लोग जा रहे हैं हैदराबाद। जैसे कि आपको पता है, हम साउथ इंडिया में बैंगलोर, हैदराबाद, चेन्नई, ये तीनों लोकेशंस पे बहुत सर्जरीज करते हैं। दिस टाइम वी आर एज यूजुअल गोइंग टू गो टू हैदराबाद टू डॉक्टर ममता दीनदयाल एंड डॉक्टर आरती दीनदयाल हॉस्पिटल। वो दोनों बहुत मशहूर गायनेकोलॉजिस्ट है वहाँ के। इनफैक्ट ममता मैडम का तो एकदम एक हेरिटेज गायनेक प्रैक्टिस है, यू नो, विच इज इटसेल्फ अ ग्रेट थिंग। एंड ये भगवान की दुआ है कि उसने हमें ये अपॉर्चुनिटी दी है कि हम जा सके ये सब सिटीज में। इतनी अच्छी हेल्थ दी हुई है, इतना अच्छा स्टेमिना दिया है कि 2 दिन में 27-28 सर्जरी करके वापस आ सके, सब पेशेंट का अच्छा एक कर सके। एंड जो डिजायरस आउटकम है पेशेंट को सर्जरी के बाद में, बहुत लोगों को प्रेगनेंसी चाहिए, बहुत लोगों को पेन रिलीफ चाहिए, ये सब हम उन्हें करके दे सकते हैं ममता मैडम और आरती मैडम के मदद से। सो आई थिंक दैट्स अ बिग ब्लेसिंग एंड लेट्स होप इस टाइम भी बाकी सब टाइम की तरह जो सर्जरीज है वो अच्छे से ही हो जाए। एंड लेट्स प्रे टू गॉड फॉर दैट।
February 29th marked a bustling day at Mamta Fertility Hospital with a surge of patients flooding the premises. The waiting area was packed with an overwhelming number of individuals eagerly awaiting their turn to consult with the doctor and undergo treatment. Meanwhile, in the operating theatre, there was this one case that Dr. J. Mehta and his team were discussing before starting the operation.
10 साल हुए सिजेरियन होके, 10 साल से उसको पेट में दर्द है, स्कार की जगह में, और दवाई ले चुकी, स्कैनिंग करा चुकी। वहाँ छोटा सा एक मास है एब्डोमिनल मसल में बोल के बोला गया, बहुत छोटा है, 1 सेंटीमीटर का, तो बस दवाई लेती गई, छोटा ही है, तो सर्जरी
that's okay ना। अभी this is a common thing के It's medical management will not work on this any which ways.
Now they have come for surgical.
सिर्फ सर्जरी काम करता है, बिकॉज कार एंडोमेट्रियोसिस में प्रॉब्लम ये है कि अंदर कोई टिश्यू नहीं है, इट इज जस्ट फाइब्रोसिस। तो जब कभी भी अंदर से सिर्फ फाइब्रोसिस रहता है पेशेंट को, मेडिकल लाइन ऑफ मैनेजमेंट वैसे भी काम नहीं करने वाला, इट इज जस्ट टेम्पररी पेन रिलीफ। प्रॉब्लम इज कि वो एक बार पेशेंट जख्म खा चुका है ना, मतलब अपन बोलते हैं कि यू नो शी हैज ट्राइड 9 months, कुछ काम नहीं किया, नाउ शी इज हरसेल्फ कन्विंस्ड कि यार दवाई काम नहीं कर रही है तो सर्जरी करना बेटर ऑप्शन है, क्योंकि अल्टीमेटली शी रिक्वायर्स सर्जरी ये सब चीजों पे।
और जितना भी छोटा रहने दो, इफ इट इज कॉजिंग पेन दे हैव टू नो दैट दे शुड गेट,
पेन इज बैड ओनली,
बट आई थिंक छोटा है तो दवाई के साथ बिगड़ जाएगा।
दैट्स अ कॉमन काउंसलिंग कि छोटा है छोटा है छोटा है तो कुछ फर्क नहीं पड़ेगा, पर अभी छोटे में भी इतना दर्द होता है तो फर्क तो पड़ता ही है।
10 साल से सफर।
एग्जैक्टली, नाउ शी विल बी रिलीव्ड बिकॉज नाउ वी विल डू दैट वाइड लोकल एक्सिजन। एक बार एक वाइड लोकल एक्सिजन हो गया, आई थिंक देन यू विल सी दैट over a period of so many scar endometriosis which we have done, almost everybody has had a complete relief. Patients are super happy. So let's see क्या होता है उसको अंदर।
Complications क्या है इसमें?
Frankly speaking, wide local excision अगर आप करते हो, you are removing the bad tissue. सर्जरी की जाती है कॉम्प्लिकेशन, जो उसको पेन है उससे ठीक होने को, उसका सर्जरी थोड़ी ना उसको और कुछ कॉम्प्लिकेशन करेगा, as long as the excision is done correctly. See, that's why हम लोग क्या बोलते रहते हैं पेशेंट को काउंसलिंग में भी कि यार तुम कोई एक्सपर्ट के पास जाओ जिसको ये डिसीज को वाइड लोकल रिमूव करके नॉर्मल टिश्यू प्रिजर्व करने को भी तो आना चाहिए, रादर देन जस्ट see, one can just go and remove everything which comes on its way and probably it will not help the patient. Better is to remove everything in a safe manner such that there is no recurrence and you have achieved wide local excision proven on biopsy.
Right.
Which is important for the patient, isn't it?
And what's the largest endometrioma size which you have?
So, in our series, we have gone up to 8 centimeters also.
Itna bada?
Yeah, it's like a huge lump lying down here. है ना? But then that requires complex reconstruction. The problem is, why should a patient wait till then? See, even if she is late, the good thing is her disease is small. So small disease, her recovery is good. Forget our comfort.
Wise, we are only getting away with a spinal.
Yeah.
Anesthesia wise, we are giving only a spinal.
So there's hardly any risk involved, whether it is anesthesia or whether it is the real surgery.
No, that's the best thing about this entire thing. So.
And they're also, they keep asking कि कितने दिन का admission है, कब normal काम कर सकते, or can they get, can they lift weights, can they walk up the stairs, ये सब common questions है surgery के बाद.
Practical is simple. You are going through the scar. Scar healing will take 48 hours. So what we tell patients, you do weightlifting after 2 weeks. But you can walk around the house and like मान के चलो
early ambulation.
अर्ली आप घर का काम कर सकते हो, घर में जो काम करते हो, ऑफिस जा सकते हो. देयर आर पीपल हु गो बैक टू ऑफिस इन 3 days.
Right.
So वो तो प्रॉब्लम नहीं है.
Back to their normal activities,
Absolutely.
physical activities well after 2 weeks.
The good thing is, even if you put a mesh inside,
Right.
people are allowed to go back in 48 hours, right? So even if you put a mesh where the size of the disease has to be more than 4 centimeters, तो वो सिचुएशन में भी तो पेशेंट घर पे जाता है.
Certainly, successfully managing a day with 18 surgeries requires meticulous organization and effective communication among Dr. J. Mehta and his team. Each surgery must be carefully scheduled, ensuring enough time for preparation, execution, and recovery. Additionally, maintaining a sterile and safe environment throughout the day.
Dr. J. Mehta, his precision, his attention to detail, his speed of surgery, and his expertise. Our anesthetists are super happy because surgeries which would normally take around 3-4 hours are getting completed in an hour and a half, maximum 2 hours, and patient's recovery time is better. They're getting discharged faster.
So that is the reason we are able to achieve numbers of around 15 a day and 23 in 2 days. So all thumbs up to Dr. J and the team of gynecologists and anesthetists who are working in clockwork precision.
And we finished around 23 surgeries for deep endometriosis, Mullerian anomalies, adenomyosis. We did 2 or 3 discoid excisions for bowel endometriosis in Hyderabad. And I'm very happy to inform you that all the patients are doing very well. They have gone home happy, which is again a very important moment for all of us. And it is simply wonderful that we've been able to achieve something like this. And a big thanks to the entire team at Mamta Fertility Hospital, Dr. Aarti, Dr. Mamta Madam, Dr. Raj, his team of anesthetists. Everyone has put in incredible efforts, and it's gone off absolutely and perfectly well.
And not one patient had any issue with recovery or analgesia or any of these problems, mainly due to the cut down of the surgical time.
And I'm so happy to be associated with Dr. J, and he's such a pleasant, wonderful person to work with. The atmosphere in the OT is so supercharged when we are working on these 2 days, and I'm so happy that we could offer these advanced laparoscopic surgeries to our patients across Andhra, across Telangana.
So that is the good thing that we are experiencing, and I think we are on to the next generation of laparoscopic surgeries.
So many of these women who have been suffering with severe pain, menstrual disturbances, fertility issues, we could really do a great job on them, and I'm so happy that this association is able to offer this wonderful care to our patients.
With dedication and teamwork, Dr. Mehta and his team can strive to meet their ambitious target and provide the best possible care for their patients. If you've been watching until this point, please make sure to like, share and subscribe to our YouTube channel for more informative content in the future.